Hey everyone, I don't know whether to apologize to y'all or to say you're welcome, but you're getting a lot of episodes this October. And that's because I had already gotten a whole lineup of writers who are writing like disabled writers who are doing spooky fiction. And then I was like, oh, we have a election coming up. And I realized that on TikTok, I get to talk to actual people who are running. And some of them are nice enough to come on this podcast. And there's no way I'm pushing anyone off. So October is just going to be your disability, invisible illness chat month, I guess. This is someone I've been desperate to talk to. I ran across her in my FYP. I'm on TikTok way too much. It's a problem, I know. But I did get to see what she had to say, and oh, was I excited. And y'all know me, I'm a little snarky, little. I'm very snarky. I am easily made sad. I'm still a little heartbroken over some of my past politicians that I'd really supported who hurt my soul, Cory Booker. And I'm really excited, and I'm not even cautiously excited. I'm just excited. So I would like everyone to welcome Tessa Lynn Hodge. She is running for the seat District 23, and I'm specifically interviewing people who are coming up on incumbents or have some really amazing platforms and are not taking money from terrifying corporate overlords. So, hi Tessa. How's that?
Hey, thank you for having me. That's a fantastic intro. Thank you so much for having me. I really appreciate it.
No worries. You're just someone who just seemed so like you are walking the walk, you are talking the talk, and you're actually one of us. You did not come from some insane hedge fund. You actually did your service in your community. You are a licensed social worker, if I remember correctly.
Licensed clinical social worker.
You've been on boots on the ground in your community. So I mean, like, I don't think that there's anyone besides social workers and elementary school teachers who know more about what's going on in a community. Maybe nurses. Maybe
There we go. My husband is actually a special education elementary school teacher. So
okay.
we have both.
Pretty fault for both of you. Like, your husband is also a badass. Like, I watched him get arrested on TikTok because someone was giving false claims. Y'all have quite the story, and I just cannot underline how brave you are. Because, like, there's so many of us who are on TikTok going, "Why aren't you doing something? Do something, someone!" And then no one's looking at themselves. Like, we're all waiting for Superman or for like Wonder Woman to fly in and save us. You guys are actually showing what that work actually looks like.
Well, and I think, my husband and I come from a very privileged place. Like, we are both pasty pale white skin. We are a straight presenting couple. We both have good jobs. We're financially stable. And so we really come from a place of like, we can take those risks, right? Like, we are physically able to put our bodies on the line. We are just in a place where we can stand up for others that are not in a place to do that. And so I really think it takes looking at like, okay, where am I? What can I do? And my husband and I are just, really in a position where we can do a lot. And so we're doing our best.
No, I mean, it's like what I've always told my kids, which is, when you have any of this like pasty privilege or any economic privilege, that comes with the responsibility to help the other people who do not have that privilege get that privilege. Like,
Absolutely.
yeah. So tell me about this journey, because I can only imagine the journey it goes from I'm really upset, frustrated, and angry to I'm going to run.
Yeah. So as you said, I'm a licensed clinical social worker. So I'm born and raised in my district. I have lived here my whole life. And I came from a very working class family. My mom was a bartender my whole life. My dad worked construction. He was a union construction worker for 25 years. Now he's a building inspector. And unfortunately, my parents did struggle with mental health, addiction issues. So I, grew up kind of having to deal with like the consequences that come along with having to struggle with some of those things. But I was very fortunate that I was able to make it through. So went to school, got my master's in social work. I became a licensed clinical social worker, and kind of through my career as a social worker, I've worked in many different facets of social work. I've done medical social work in our local hospitals. I've done community crisis response, school based mental health, community based mental health, child welfare, policy and legislation. And then I currently own my own private practice. And I was doing both, doing community based mental health and my private practice. And then in July, left the community mental health so I could just do private practice and focus on campaign. But what really led me to the campaign and doing what I'm doing is really kind of like up to the lead up of last November. A lot of conversations with people that I was working with was like kind of a nervous laughter, like, he's not going to get elected again. We're going to be fine. And then November happened and it was like, okay, we survived once. It's going to be tough, but we can do it again. And then January came and we all saw how bad it really is, right? And I was kind of sitting here and first reaction was like, "Oh my god, like we got to move. We have to go." But then I was kind of like our escape.
It's been like, I was like there with like PowerPoint presentations on where we should move.
Yes. And so as I started like planning our escape, right? I was like, wait a second, how could I just leave the people that I serve? Like, I really was
Yeah.
like having this conversation in my head, like, how do I justify just up and leaving the people that I serve every day? And so having conversations, with my husband, the conversations that I was having in sessions with my clients really just kind of led me to this place of like, I have to do more. I cannot just sit here. And like, as a mental health provider, I can provide coping skills. I can provide a safe space. I can validate your feelings. I can help you build a distress tolerance so that you're able to kind of regulate in like this craziness that's happening. But it does nothing to touch the actual systemic root of what is going on. And so I just really felt like, okay, like I got to do more and this is what I can do. And so I decided to run for office. My husband has very quickly become like the organizer. And if you can hear my dogs barking, I'm so sorry.
No, no. If someone has a dog that they actually take care of, JD Vance, I am instantly gives me such like love and like I trust people who have pets so much more. And I know it's not necessarily fair, but it's just like if dogs trust you, I tend to like you a lot more.
We have 6 of them. So
My husband has finally put like our dog that we just got was supposed to be my service dog. That was never going to happen. He is too friendly to be a service dog. But
mhm,
literally catatonic after the election. I was not leaving my bed. I was just, and it wasn't because I'm sick and I'm in bed. That's most of the time. This was like I was so depressed I couldn't function. And he
yeah.
was like, "I'm getting you a puppy. It'll be your service dog. I'm getting
There
you a
we
puppy."
go.
And it worked. I started getting out of bed. I guess I
Mhm.
could medication or got a Labrador. I think the medication would have been cheaper. But yeah,
Sorry, sidetrack. I will
the
scold
show
every.
is nonstop sidetrack. I'm so sorry. I have like the attention span of a gnat with ADHD, and yeah, you get sidetracked a lot here.
There we go. That's okay. That reminds me of the song Kirby from Aesop Rock, and it's about his cat named Kirby. And there's a line that says, "I don't know." A shrink said, "Maybe get a kitten." And it's like, yep. So I feel that. But yeah, so my husband very quickly kind of became like the organizer in our area. He's working with Indivisible and 5051. He's now the chair of our local for the Direct Action Caucus for our local Democratic Club. He does it Progressive Democrats. He, yeah, just very quickly was like the guy to go to organize protests. He just had a protest this last Friday against Chad Bianco, the Riverside sheriff. Yes. He was doing a fundraising event in our area, and so my husband organized a protest for that. So, yeah, I'm doing what I can, he's doing what he can, and we're working together to try to do something.
So then my next question is, how many times have people called you Leslie and Ben?
Never, but I welcome it. I welcome.
Yeah, it was very giving Leslie and Ben.
What's so funny is when I graduated with my bachelor's in social work, I decorated my cap and it was, I care a lot. It's kind of my thing, which is a Leslie Knope quote. And that was my cap for my bachelor's graduation.
Up until this election, that was one of my favorite shows, and I used to watch it like as my comfort show. And then this election, I can't. It makes me like sad. Yeah,
Yeah, I
but
get it.
we just started talking, and like Catherine Hahn, by the way, is still one of my favorite. Like I love my husband. We've been married for 20 years, but I honestly like if that woman ever went to the other side, I don't know how long my marriage would last. Like just my favorite person, like on TV. Sorry, that's another sidetrack. When it comes to like the whole like trying to get elected, we were talking about this before we started recording. How like it is what we saw with like Leslie Knope, where she is constantly being restricted by, like, when you are anyone other than the white Christian healthy male cis running, like, Trump didn't even show up for his debates. Like, so you're constantly being like hobbled, yelled at by people about things that you aren't even in charge of. Yeah, that was a nice 2024. So how like that is? Was there anything in that show that you're like, oh yeah, this actually feels very real?
I am still waiting for my red carpet and the ice rink moment.
But you need like a dog and Aubrey Plaza. I think everyone needs Aubrey Plaza.
I have a three-legged cat. Will that work?
It'll work. We just need to get Aubrey, and you're like in the neighborhood with Aubrey.
I have a dog with no teeth. Like, take your
I think
pick.
you need to get Aubrey over there.
I if we could get Aubrey Plaza, like, on the campaign trail with me, I think it would go really far, and I'm open to that. Aubrey, have your people
Yeah,
call my
Aubrey, Catherine Hahn.
Yeah, there we go.
That's my number.
But I think, like, there very much is kind of, I do have I always forget to what a consultant. I do have a consultant. But he's a local consultant, like he's not some big DC person. Like he does like local regional campaigns. So he's worked on like other regional campaigns in my area. And when him and I first sat down and kind of talked about, like if I wanted to hire him, I said, like, the biggest thing is like, I'm not going to be your traditional candidate. And like, you cannot expect me to be a traditional candidate because I'm just not going to. And he said, no, like, I've done my research on this race. I've looked at all the candidates and I chose you for a reason. And it's because you're not a traditional candidate.
Mm.
And so, like, early on, there were a lot of people saying, like, okay, like, this needs to happen and you need to do this and avoid this. And I'm like, I'm really taking my work as a social worker and as a mental health therapist and really kind of transitioning it to how I approach my campaign. Because as a social worker and as a therapist, the biggest indicator of success for my clients is the strength of the therapeutic relationship, right? Well, to have a strong therapeutic relationship, you have to have somebody that's being genuine. If I'm not bringing my genuine self to my sessions, how can I expect my clients to form a strong therapeutic relationship with me? And I'm approaching it the same way with my campaign. How can I expect the people that I want to be my constituents, the people in my community, to have faith in me and to have a strong relationship with me if I'm not being my genuine self?
Mm.
And so it was really important for me to find people that backed me, that knew I'm not going to be a traditional candidate. I'm of course going to take advice, but at the end of the day, like, I'm going to be me. But I got a comment not too long ago that I needed to change the way I dress and that I needed to hire an image consultant. And I was like,
Who said that?
no comment.
Mm. Mm.
Comment.
You have such like a cute little rockabilly thing going on. Like, it's adorable. Like,
I
why would
think, listen, I think I look friendly and approachable, and I am friendly and approachable. And I think that's what's missing from politics is like politicians are not supposed to be these like weird idols for one, and they're not supposed to be
oh
these
my
like
god.
untouchable people, right? Like politicians are supposed to be the people that are representing you, the people that are in touch with your neighborhood, the people that are in touch with your community, the people that you're supposed to be able to go and talk to when there's an issue. And so why would I want to brand myself as anything other than what I am? Because I'm approachable, I'm nice, I'm bubbly,
Funny.
and I'm funny. I think I'm hilarious.
You are
Um,
too?
yeah, maybe I'm not the most professional presenting person ever, but I'm gonna take
John
approach.
Fetterman comes around in like sad sweatshirts and like I'm sorry, Silicon Valley, which is like where I've done my professional living, has basically made unprofessional vibe the vibe. So just because a white man does it does not mean the rest of us can't.
There we go. There we go.
If I
Love
did it,
that.
how hard is it really? No offense, boys, but it's just kind of exhausting. So, what are some of the things that you were like? this is the reason I have to run? Is this thing that you saw when you were working in social work? Is this just a general you turned on the news and went epileptic? Like, what was the aside from like 2024, which that's totally a fine reason too, but is there something that in your personal life you're like, I've got to work on changing this?
So it's a whole huge number of things, but you know, really just seeing how things are going to impact my community, my clients, how it's already impacting my community, my
Are we
clients,
talking about the
friends.
great big beautiful bankrupt bill?
Yes,
Rural hospitals and what this will mean for Medicare, Medicaid?
yes. So, I mean, there's a whole host of issues with that. But so in my district, the 23rd district is a primarily rural district. And we are absolutely massive. We are bigger than some states because
What
we are.
cities? Because I don't know if everyone's gonna know what those cities are in your district.
Yes. Okay. So the 23rd Congressional District here in California, it encompasses the high desert. So that's like Victorville, Hesperia, Apple Valley. And then it goes to the north to Kern County and Los Angeles County. So we have California City and Lake Los Angeles. And then it goes to the east all the way out to the Nevada border. It goes kind of south-ish to Joshua Tree National Park. So we have some of Joshua Tree National Park and we have like the Morongo Basin. So that's Joshua Tree, Yucca Valley, and Flamingo Heights, like all those areas. And then it goes up to our mountain communities of Big Bear, Lake Arrowhead, and those communities up there. And then it comes down into Park, Redlands, and Yucaipa. So it is huge and massive.
Big. I had like a thought of it and it was like half of that.
Oh, yeah, no, it's absolutely, it takes a solid, depending on traffic, like 3 hours to drive from one end to the other, like any which way you go.
You're
Yes.
also dealing with some varied like, I always think about this as, like, the United States, any sort of district, it's a group project, and you're working with people who might be diametrically opposed to you, and your district is, like, many districts of diametrically opposed, like,
Absolutely.
so how do you become a teacher for a group project where people, might not believe the other people deserve to exist or deserve to be in that room or will constantly, like, decide that they will vote for vibes rather than policies?
Mhm, mhm. So I think the big thing that, like, the big way that I'm approaching things is like, am I running as a Democrat? Yes. But I'm really approaching my campaign from a community first standpoint. And our communities, the communities in the 23rd Congressional District, are communities that historically get overlooked by San Bernardino County, by the state. But like, we are just kind of like, oh, that's them desert people. Like, meh, you know? So we very historically get overlooked. And so I'm really approaching this from a community standpoint of, look, the people that live in Redlands are going to have very different needs than my people who live out in Barstow. So we're talking like a very city area that has a high amount. So Redlands is very city, has a high amount of like doctors that live in it because we have a very large teaching hospital right there. But then Barstow is way out, teeny tiny city in the desert, not a whole lot of resources. The needs are going to be very different. But the thing that's going to impact both of those cities equally is these cuts to Medicaid, Medicare, the ACA, all of those things. So in our district, just about 50% of the hospitals in our district are likely to close because of the big, ridiculous bill. So there are people in my district who are going to have to drive over an hour to reach a hospital. And so for the people in Redlands, their hospital is fine. Their hospital isn't going to get touched. But already, people in other areas of the district have to drive to Redlands to see specialists. That is only going to increase once other hospitals in the district close. There's 4 hospitals that are at risk of closing. So wait times are already super high. What's going to happen when people from over an hour away are now having to drive to your hospitals? The wait time is going to go up even more. And so I'm really approaching this from a community standpoint of, listen, we may not agree on every single issue, but I'm here. I've worked in our hospitals. I've worked in our community. I've worked for the county and in policy in legislation, and I can see directly how all of these things, even in other areas of the district that are way far off from you, are going to impact you directly, but I have solutions for them.
And what are some of the solutions?
So I'm going to speak kind of directly about like emergency room wait times, right?
Yeah.
So my closest hospital, well, there's two that are close to me, but the primary one is St. Mary's Medical Center. And I, for a short period of time, worked there as a medical social worker, and the ER wait times are crazy. I mean, we're talking like 8 hours in the ER for wait time. So, one of the issues is, of course, short on staffing. So, short on nurses, short on doctors. There needs to be more staffing. But the other big issue is there's not enough skilled nursing facilities. There's not enough memory care facilities. There's not enough access to things like home health care. So when we have people that have been in the hospital for 2, 3, 4, 5 days, whatever it is, and they're ready to be discharged, but they may need to be discharged to a memory care facility, a skilled nursing facility, or they can go home if they have access to home health. If they can't get any of those things, if they have to wait for a bed to open, if they don't have access to home health or to be able to pay for it, guess what? They're sitting in that hospital bed even longer, taking up a space. Meanwhile, we have people in the emergency room that need to be admitted, that have been admitted to the hospital, that are taking up a bed in the emergency room, waiting for a bed to open upstairs. So that means that the people in the emergency room are waiting even longer for that bed in the emergency room to open. And so it's this chain effect. So if we can open up more skilled nursing facilities, if we can increase access to home health care, if we can have memory care facilities, if we can have these other options, that's going to ease some of the burden on the hospitals. And then I'm also looking at things like how do we expand teaching programs for nursing students. Right now, Victor Valley Community College, my local community college, has a nursing program, but there's a wait list for it. How do we expand training opportunities into our remote cities so that we can get people actually from the community to get the education that they need to actually work in their community? And so I think those are some of the big things that, people aren't necessarily looking at, but they have really big impacts.
And they also have a history. The thing you just described was done very successfully, and I'm forgetting which coal mining town, but there was a coal mining town that the mines had closed down, and they had a lot of people with no jobs and a lot of people with very sick respiratory issues. So they did a program exactly what you're describing. The thing that they did was they made the nursing school free. And the community came together and they went to school, and now they all had well-paying jobs in the healthcare facilities, and you did not have the addiction that you would expect in that town to occur
Mhm.
because, people, when they have hope and life, tend to choose different things.
When there is an opportunity to better be upwardly mobile, to better your situation in life, you're going to take that. You're going to take that.
Trying to explain to people, like, the taxes are gonna go away. People are going to take taxes. Where do you want them to spend it?
Hmm.
And when we spend it on people, and when we not corporations, when we spend it on the everyday people in education, in bettering, we see, like, the return on investment's insane. I'm so sorry. I'm not running, you are. My apologies. I just wanted to make sure that, like, everyone who's listening to you is like, "Yeah, I've heard that before." And it's like, "Yes, but it's been done before." I want people to understand this isn't a pipe dream. It's a successful program that has been implemented before, that has real world history behind it with real world success. I just wanna make sure everyone understands what you're saying isn't just, "I'm promising rainbows and ponies." And when people are asking like, "Well, where's that money coming from? Nothing's free in this world." I hate that. We've actually seen how this pays for itself and then pays for the next generation of people that do it. Like,
Exactly.
this is actually economic sense. Everyone who thinks that Republicans are making economic sense, I need you to actually look at the numbers.
Exactly. Exactly. And here's the thing. So, and I take kind of my own story and use this as an example. When I was 16, I was in a fatal car accident and two of my friends were killed. And in my early 20s, I was diagnosed with post traumatic stress disorder from that. And I could not, there were days I couldn't even think about getting in the car because I would just freeze and have a full blown panic attack. How do you go to a job? How do you go to school when you can't even get in the car? And this was back in, 2000 and holy moly, like 2009. And so this was before, telehealth was the thing. And so accessing services, even to access therapy at that time, I had to, through my insurance to access therapy to get an in person appointment, I actually had to drive. For those in Southern California, down the Cajon Pass to Fontana to see a therapist, which is about a 45-minute drive. And if there's traffic or an accident, it could be a 2-hour drive. So, how do I access therapy for PTSD related to a fatal car accident when I have to drive 45 minutes to get to it? And so, like, the math is not mathing, right? And so at that time, I wasn't able to go to school. I wasn't able to work. I wasn't able to hold a job. I could barely get out of bed most days because I just, like, the depression, because I couldn't do these things, was so real, right? So, was I contributing economically? No. Was I doing anything productive? No. Just because I couldn't do those things does not mean that I'm not worthy as a person, right? Like, being productive and getting out of bed, like, does not inherently make you a worthy person. But I wasn't contributing tax dollars in this capitalist system. And so I was able to get into treatment. I got a service dog, which really changed my life. It, like, made a huge difference for me, really gave me my life back. And I was able to go to school, and I was able to get my bachelor's in social work, and I was able to get my master's in social work, and I was able to get a professional license. And I've been able to hold all of these positions because I was able to get the help that I needed, to get the mental health care that I needed, and to get the services I needed for my disability at that time. And now look at me. I am a productive member in our capitalist society.
Yay, you graduated into making money. First, I'm so sorry for what happened to you. I'm also I'm really impressed with your story is such an important story for people to hear. Because I think that especially when we're in those moments, I haven't had your exact experience, but I've certainly been where you were. It's really hard to justify to yourself existing, let alone when you get all of this other feedback in your ears.
Sure.
And right. And the thing is we do not value the cocoon stage. And all of us, if we have any self-reflection, will devolve in a cocoon until we like break out. As becoming is hard.
Hmm.
Becoming what we're supposed to be, who we want to be, what we need to be is a process. And sometimes that process is flipping through TikTok until you fall asleep.
Hmm.
It's an imperfect process. But you
Hmm.
have a really amazing story. I would love to hear more about if telehealth is part of your plans for the future because so many of us are disabled and physically unable to go. I have a lot of discussions with people because I have to do physical therapy to relocate my bones. And I have a very, what they say is an uncommon disease, but it's pretty, there's a lot of us who know Ehlers-Danlos at this point. And, like, explaining, like, the privilege level I have that someone's going to show up at my house in another hour to drive me to physical therapy. Well, they will drive in the kindest way possible and get me sweet treats because it hurts, and
Hmm.
then carefully bundle me back up and then deposit me in a heated bed with my puppies and all this medical equipment to make me not cry. Now, if I
Hmm.
did not have that, even getting to the doctor or my pain clinic makes me go in person, which is agony, and I sit there and cry in my pain clinic. And they're asking
Hmm.
me, "Why are you here crying?" I'm like, "'Cause you're a pain clinic and you made me show up in person. Why are we doing this? Please just do telehealth. Like, this is cruel." And if you think about, like, someone who doesn't have any of this privilege would have to
Hmm.
get on a bus. They would have to put on clothes, get into their mobility device, go to a bus that may or may not show up because 'cause they've certainly driven past my child who uses a cane.
Hmm.
Like, it's insane to get any sort of medical care and the physical agony, let alone the cost of the bus, let
Hmm.
alone the cost of the appointment. I'm so sorry. I'm rambling. My
No,
apologies.
you're totally fine. These are all valid points. They're valid points.
You are literally someone who can actually do something, and I'm so used to just, like, yelling into the ether. So I'm so sorry I'm taking advantage of you. That is not fair to you. But is telehealth gonna be a part of this piece of the puzzle? And is there something that can be done? I know that we're really hamstringed, and I know we're constantly screaming at our politicians, "Do something," and you're like, "Cool, so here's what I can do, and here's what I can't do." So what is possible? What are your powers, and is telehealth a part of something or a program that you could help run?
So I definitely, like, part of my platform is healthcare reform. So first and foremost, I am a Medicare for all. Like, I'm sorry, like, every single person needs health insurance. Like, If I also have asthma. If I can't breathe, how can, again, just going based off of capitalism, because that seems to be that's the measure in our society, right? So if I can't breathe, how can I go be a productive member of society, right? And so it makes sense that if we want people to be contributing productive members of society under capitalism, that maybe it would be helpful if they were healthy, right?
Hmm.
And again, I'm using the capitalism argument and all of that, not because I believe that that's how it should be, but that is the system that we are in. Want to see healthcare for all. And so a big part of my platform is healthcare reform for both the patients and the providers. Because I do have this perspective of being a provider, right? And so I often think about this TikTok that I saw, and I think his name is Shane. He is in a mobility device, and the TikTok that I'm thinking of is he's like, "Yay, get to go to the doctor today to prove to the insurance that I'm still disabled." And he like goes through like the tests and stuff, and he like is obviously disabled. And so he's like little tests, and he like knocks, like something on the table, and the doctor's like, "Oh, like, good job." And he goes, "Does that mean I'm better?" And the doctor's like, "No." Because it's so silly, right? It is so silly that someone like him, someone like you, has to prove over and over and over and over again, when we have these disabilities that don't go away, that are lifelong, that are chronic, why do you have to continuously prove that you are disabled? It takes up resources, it takes up time, it is completely ridiculous. So looking at things like that, right? If we have somebody that is, very physically disabled, and we know that that's not a condition that's going to go away, why does somebody have to do that every year? So that's part of it. Increasing and expanding access to telehealth. Absolutely. Increasing access to things like what you have, right? That they will come, they will transport you. We have transportation services in my area for some people. But when I think about people that live an hour from a specialist, right? Even now, they live an hour from a specialist, and there's not readily accessible transportation. They don't have enough money. They don't make enough money on disability to provide their own transportation. There's not public transportation, all of these things, right? So, expanding access to telehealth, expanding access to specialists, expanding access to, even for some people who would qualify, home visits from
Mm.
from medical staff, right? So that way we're not making people who it is extremely excruciatingly painful and difficult to get out of the house, that we can accommodate that. And then I think for providers on our end, the endless paperwork and the endless amounts of hoops that we have to jump through, I often think about, I can be audited by an insurance company at my private practice anytime, and they can claw back money whenever they want. If I don't cross a T or dot an I right, they can claw back money. Why are we not clawing back money from corporations who are giving subsidies to keep prices low, but then they jack up prices anyways? Why are we not clawing back money from Why are we clawing back money from therapists and doctors that like didn't cross a T right? Like, that's ridiculous. So lowering the barrier for doctors and providers to be able to provide. And then also in terms of like mental health care, right? I like to joke that when therapists leave grad school, we leave knowing just enough to know that we don't know anything. And so much of our learning is after grad school, but it is so expensive to get specialized. And so when we think about like co-occurring disorders like mental health and like substance abuse, when we think about disorders like schizophrenia, bipolar disorder, borderline personality disorder, all of these things that are maybe a more significant diagnosis, to get specialized in that is cost prohibitive. It's very expensive. And it's really difficult to find the training in in those areas. So there's a lot of therapists who don't have the ability to do that. And so we have a shortage of therapists who are qualified to treat these more significant conditions. And so when we look at, and I'm rambling now, but when we look at medical care reform, we have to reform it for the patients. We have to reform it for the clinicians and the providers as well.
I agree. I think you should also even go a little further to it has to change for the students. The
Yeah.
students need to be able to afford to go to school. There's my baby.
Dog.
You feel like you want to say hi? Do you want to come up here and say hi? You can come up and say hi. No, it wants to be a pain that nope, still not good. You're still being a very bad dog. Because this is just real life. Hey, baby, you done? Thank you. Oh, they're so cute.
Until they're a menace.
My gosh, I bought so many bras, and whenever you get to like anything like this, it's not just a bra; it's a structural support garment that like requires an architect to sign off.
I
And
feel that. I feel that.
yeah, and so they're not cheap things, like they're like $70 a garment. And he's like, "Oh, thanks for the snack. That was so helpful. I love the snacks."
My husky ate my Converse the other day, so I get it.
Ate my marrows. Just like that was like snacks, I guess. I don't know. I'm so sorry. So he got me off topic and now I can't think. So we were talking about mental health and about students
Wait,
being able to afford to go to school. Like I know I'm old. I'm very aware. Almost 50. And when I went to junior college, and I went to the school here in California, and it used to be free. College used to be free until Reagan. And Reagan was like, oh, people who don't look like me are going to college? No, we can't have that. They're becoming lawyers. What happens when they become lawyers? What happens if they become a doctor or a politician? My God, imagine. So that's where we got this now insane thing where we are paying obscene amounts for college because it was $12 a unit when I went. And that was significantly more than my parents paid because my parents were able to work a summer job. And in the Bay Area, in like Berkeley, California, they could work a summer job and pay for tuition at a state college, a 4-year college, and have an apartment and food. Now, I went to school in the 90s.
even. Oh my god.
And no, that was not possible. And I went to graduate school in the early 2000s, and I was paying that off until I was diagnosed with a disability that was degenerative and would never go away. So it changed so drastically from my parents to me to now my children, where
Mhm.
it's $50 a unit for junior college. Now, when you're talking about things like addiction and wanting to do good things in your community,
Mhm.
how are we supposed to get the people who actually understand addiction into college? How are we supposed to do that? How are we supposed to get this where they can't, like, I don't know if you've been near Stanford at all. This is in the
Mm-mm.
richest city in the state. You cannot get a house in Palo Alto for like less than $6 million.
Oh, yeah.
And
Yeah.
you go to that campus, it is just a line of RVs because students can't afford.
Mhm. Mhm.
So, what are we like? How are we supposed to get the people who actually want to be social workers, really want to be teachers, really want to be doing this work, want to be nurses, want to be doing memory care? How are
Mhm.
we going to get them educated in this if we are not solving housing crises and the cost of the
Cost of
education?
living, cost of education,
Cost
all
of
of
healthcare, because let's be real, there are 16-year-olds who are out of household right now.
yeah.
This is not something that's just, the legislation drives me nuts in the state as far as like how we do things. So I'm so sorry. Again, I'm not running. I'm so sorry. I just wanted to make sure that telehealth was a big part of your plan, especially since like it seems to be one of the most economic ways of handling this change and how we're going to be not funding rural healthcare. At least we could get some basic stuff done. I'm so sorry. My teeth are like gritting so bad at this. Like it's turning into powder. I'm so like horrified and terrified for everyone. And we already didn't have the doctors and nurses. And now we're going to.
Only going to get worse.
And I honestly don't understand what the upside is. I'm so confused as to what like a lot of the stuff, it's follow the money and you can kind of figure it out. I've tried to follow the money on this, and all I can think is they just hate us economically. Like this is going to be less taxpayers, less people alive, more stuff. It's like what's the and that's the point. It's crazy. I don't get it.
And I feel like some of this is, I mean, a lot of this has been in the works for a number of years. I mean, for decades, really. Like they've been working to get the
70s.
Supreme Court to where it's at. Yes. But I also feel like some of this is in backlash to So, like, after 2020, there was that, like, period of, like, the Great Resignation, right? Where people were able to move around and to increase, their pay and get better positions. Like, I know I certainly did that during that time. I literally went from one job, and this was after I had my master's degree. I went from one job to another that was a $13 an hour increase.
Jeez, that's
Yeah.
like, that is life-changing.
Life changing. Oh my gosh, my dogs are
That's like
not.
the difference between, like, survival and being able to actually start considering a future.
Yes. My husband was able so my husband was a restaurant manager for years and years and years. And during COVID, he got laid off. And so he was kind of figuring out, he was like, I don't want to be in restaurants anymore, but like I would like to go back to school, but like how can I afford to take this pay cut? Right. Well, because I got that $13 an hour more, that made it so that it was possible for him to take a $40,000 a year pay cut to step down from being a restaurant manager to then enter into the education system as a paraeducator, making like they make no money.
No,
It was
like,
literally a $1,000 a year pay cut for us. And but he was able to do that and to start going to school because I was able to get that $13 an hour more. And now I've gone above that. But it really is, that's huge, that's life changing. So I think a lot of what we're seeing now is almost kind of like the like grasping back from that upper class, like, oh, you guys got a little too big for your britches there, like, we're gonna take that back now. Like, because everything that's happening does not make sense. If you want people to continue to buy stuff that drives the economy, if you want people to continue to go out to dinner and to get fast food on the way home instead of cooking at home, if you want people to continue to pay tax dollars, like, people need healthcare, people need jobs, people need good paying jobs. And so I don't, the only thing I can think of is that it is in response to my $13 an hour more that I got during that time. It's in direct response to that. Sorry, guys, I ruined it for everyone.
all all of it. I blame you. You're running for office, so I feel like you might wanna just get comfortable with, like, the, everyone blames you, like, I mean, I'm a mom, so I'm really used to it, but I think maybe you might wanna really, like, settle into, like, the
I've been a social worker for the last 10 years.
for Christ's
Already.
sake, you raised me on that. That is a mother, but that job is brutal. Yeah, I have family and friends in that. That's a lot. So let's talk mental health. We are seeing a insane rise, which is not shocking. I mean, we are dealing with unprecedented times daily, and I think even the most regulated of us are twitching in a corner. I feel like I'm on TikTok watching therapists go, "Okay, so I'm going to try to take my own advice, but I'm twitchy too." And then we're dealing with a cost issue. In my area, I believe it can be up to $1,000 for an intro appointment to see a therapist. And then it can be anywhere between that $1,000 down to $100 an hour to see a therapist, which is far above the cost that most people can take. And then when you're talking about parents of children who the school says needs a therapist but is not providing them anymore, it
Mhm.
becomes untenable. So I'm wondering what you're thinking as we're dealing with. I don't want to just focus on men's mental health because that is an issue just because of I mean, for so many reasons, we want everyone to be mentally healthy, but we are dealing with a higher spike of violence over there. But we also have a lot of people who are suffering and are trying to deal with things, and it's a lot. And I feel like we don't have support for families, we don't have support for individuals. What can we do about mental health? Is that part of the telehealth experience? What can we do to bring down the costs and allow for more accessibility and have the proper mental health professionals for people? I mean, there
Mhm.
are, you don't, it's like dating, I feel like it's almost like going on a date. Like, I see you have a red hat. I don't think this is going to work out for you to take care of my mental health. Thank you. That's been lovely. And I'm sure that maybe someone who wears a red hat is walking in going, "Ooh, I don't feel safe or comfy here either." Like, you have to find the person who is going to be able to help you, but also maybe does not just terrify you or for whatever reason just sort of clicks you as like, mm-mm, mm-mm.
Absolutely. What there's a and I kinda touched on some of these things already, but, like, one of the ways to bring the cost down is well, I think insurance companies, for one, if you look at the rates that they pay, providers, some of the insurance companies, pay as little as $60 an hour per session to the therapist, and keep in mind, like, okay, I own my own private practice, right? So and I strictly do telehealth from home. But if I had an office building, right? So I'm paying for the office, I'm paying for malpractice insurance, I'm paying for insurance.
Real quick, could you tell people what malpractice insurance costs? Because I don't think my dad was a therapist. That's no reason I know this.
Okay.
What is the malpractice insurance? Because I think people are like, oh, it's like $100 a month.
So, well, it's actually not that bad. Because I just re-upped mine and it was like 280 for the year, I think.
Oh my gosh, no, wow, that's impressive. Okay.
Mhm, mhm. So so there's the malpractice insurance, there's the rent on the building, electricity, like all those things, right? But then
Mhm.
there's also we have to take a certain number of continuing education units every 2 years, and that
Are
costs
those
money.
free? Those aren't free.
You can get them for free from some places, but, like, I just paid for a trauma specific course that was I think it was, like, 500. And so if I own my own private practice, I'm paying for that out of pocket, right? You're also paying for the upkeep on your license. Every 2 years, you have to renew your license, you have to pay for that. There's a lot of things that you're paying for out of pocket.
I'm just curious, like, how much is it to renew your license?
So when I got licensed, it was you had to pay like 150 or 175, I think, well, like 175 for the test to take the test. And then if you pass, then I had to pay another like 100 or 150 to board for them to be like, "Oh, yes, we will recognize your results." The puppies are not having it.
My chicken got out. I was like, if you see me, like, looking up and over, it's because my chicken escaped. She like, little Houdini, and she's just prancing in front of the window.
Oh my god,
"Hi, hi, I'm lunch. I'm just here to annoy you." Now, with your test, do you have to go in person? Because that's something that was like, my dad always had to go in person. Like, what happens if you're disabled and, like, you're in a wheelchair and or you have ADD or, like, you have other things or, like, your hands don't work or, like, whatever is like, I can't sit up for, like, hours. So, like, I had thought about going back to school to
and
get
it's a 4-hour test. It's a
yeah.
4-hour
But what
test.
happens if you're disabled and that's just something that you physically can do? You're just not allowed to be to get relicensed?
So, you can request, like, various accommodations from the board, but that's a process in and of itself. My husband, who's a teacher, my husband has severe dyslexia, has been diagnosed since he was a kid, and he was trying to get accommodations for like when he had to take his test to be a teacher. And he has like all his documentation from like 12 of like being on an IEP, and they were like, no, that's not good. You need something psychologist. It's like 2 grand if you want to get some kind of diagnosis as an adult because insurance won't cover it. So even though he has all this paperwork from K through 12 showing that he has a learning disability,
Yeah.
that he was on an IEP, they were like, nope, you need something recent from a psychologist now showing that you have a learning disability. We didn't have 2 grand to pay for that.
No, and then we're living in a world where our president and the head of the healthcare are starting to really look at, like, tagging people in a way that I haven't seen since, like, I don't
Exactly.
know, back when my family went running over to this country, and it's very concerning to get, like, these diagnoses at this point in time,
Yeah.
at least for me and my I have been, very much distracting you, and we're almost at an hour. I want to get right back to your campaign. So, give me the campaign promise that is, like, the thing that you are like, "This is if I get nothing else done, I get this done, I will have done my job."
So, I don't wanna say it's, like, a specific piece of, like, legislation or something like that, but my campaign, slogan is "People over party."
Mm, my god. So the purple unification, that's a really great slogan there.
I really believe that if you are Democrat, Republican, Independent, like, I don't care. At the end of the day, the people in my neighborhood, the people in my district, that's my community. And
Mm.
so I don't care if you're a Democrat. I don't care if you're a Republican. I don't care if you're independent. I don't care what your party is. I want you to be successful. I want you to succeed because if you are doing well, guess what? That benefits our community and I'm going to benefit from that also. And that, like, I don't know, that may come off as selfish, but like, I want my community to thrive. I want the people in my community to thrive. And we may disagree on certain things, and that's a whole nother topic for a whole nother day. At the end of the day, I want people in my community to thrive. And so we have to start putting aside these labels and we have to start getting back to who is in my community. And if they are suffering, I am suffering.
Mm.
If people in my community are thriving, I am thriving. And so my promise is that I am always going to put the people in my community over party and I'm going to do what's best for the people in my community.
I love that. Is there like some like best thing, like if you could just do something, if there's no red tape, what would it be?
Healthcare for all. That is number one biggest thing, healthcare for all. Number one.
That would be so amazing. If I could go to the hospital without going bankrupt, I would be very excited.
Mhm. Number 2 would be overturning Citizens United. So if I had 2, it would be healthcare for all and Citizens United.
Oh my God. Okay, for our international listeners, because we have quite a few of you. Hi, everyone. Also, Estonia, really? Hi, nice to meet you. Cheers. Mazel, welcome. Citizens United was one of the most devastating, well, there's been a lot of devastating Supreme Court decisions. What it did was it allowed for corporations to act as people in the way that they donate, not in the way that they get repercussions. If
Mhm.
this was actually corporations are people, when they produce things that kill people, they would end up being arrested. But no, all it means is they can donate however they want quietly. And it has completely changed politics in the United States before the chaotic. It's where we get a lot. I mean, we had APAC for a long time before that, but now it's really hard for people to. I always try to keep that in mind because I mean, there's a lot of issues, but like if a foreign country is paying our politicians, that's definitely a question. And I also try to keep in mind that it's very hard to run. It's very expensive to run,
Yes,
and
it
there's a privilege level if you don't have to take that money. Like I'm like in San Francisco, we have a person who's going up against Pelosi's seat, and he is right out there screaming, "I don't take money from APAC." I'm like, I appreciate that, but you're also a billionaire, so
mm,
you do have options that other people don't. Like when you have money and privilege, you have good choices. Now, not everyone makes those good choices, but you
mhm.
have better choices. Like, and I always try to be mindful of like, there's people who don't have those choices, but it is concerning. How are you able to, like, walk this? Because you're not taking money from them, is that right?
I'm not, and I do have to finish up pretty quickly because I do have a
I'm
client.
so sorry to kidnap you. I warned you I'd kidnap you.
No,
Not
that's
in
okay,
any way, I just really enjoy your company.
and I'm happy to come back on for a part 2 also.
Absolutely.
So, I'll kinda make this quick and do kinda like my closing spiel.
Absolutely, and wrap up with how people donate and how they find out more about you, and then we can just end it
Yes.
there, and then you can head off to your call.
So I am not taking big corporate money. I am completely grassroots funded. I am going up against the 11th richest member of Congress. The incumbent, Jay Obernolte, is worth $97 million, has his own private jet, lives in DC full time in a 3-story home with its own elevator, and has a beautiful view
Going
of
up
the Capitol.
it
Hey, and his from his rooftop balcony, he has a beautiful view of the Capitol. And so I obviously I'm still working. I have to run because I have a client right now. But at the end of the day, my community and people from outside of my community supporting me, wanting to see real change, wanting to see somebody who is going to stand up for disability rights, who's going to stand up for Gaza, who's going to say that it's a genocide, for someone who isn't going to take a big money, for someone who wants to see change in our medical system and for mental health care. Like the people that want to see change are the people that are funding me and supporting me. And I appreciate every single penny that comes in. No donation goes like unthanked because they're all huge. So my website is tessa4ca.com. That's TESSAFORCA.com. There you can donate, you can sign up to volunteer, you can sign up for my mailing list, and then all of my socials are either Tessa Lynn Hodge or Tessa4CA. Again, TESSAFORCA. And I want to thank you so much for having me. I so greatly appreciate it.
Thank you so much, and if you go to our show notes, you will see a button right there, and it'll go right to all Tessa's information, so you'll be able to get that right from our show notes if you don't remember, if you're driving. Tessa, I cannot thank you enough, not just for your time, but for running. This is a really big, hard thing you are doing, and I really appreciate that you are doing that for your community and for all of us.
Thank you. Thank you so much.
You're very welcome. Have a great day. Thank you, everyone. Be kind, be gentle, in whatever way it looks like to you, be fierce.